Should doctors face liability for every error of judgment? Let's imagine a tense moment in an operating theatre. Monitors suddenly bleep and blare. The patient's life hangs by a thread. The surgeon must make a snap decision. What if another approach might have saved the patient? Or maybe, just maybe, the result would have been the same no matter what choices the doctor had made. So when does a doctor's error in judgment become in law negligence? Should doctors face liability for every unexpected outcome? How do courts separate this unavoidable problem from the unforgivable negligence? This isn't just about doctors. It's about trust, the right to compensation, and the cost of healthcare for every Malaysian family. So let's discuss this. The dilemma is the tension between error of judgment versus negligence. In medicine, uncertainty is part of the territory. Doctors are not magicians. They are not God. They deal in probabilities but not in guarantees. Sometimes even the best treatment can go wrong. So how do we decide if the harm is an honest mistake or a failure of professional duty of care? So here's the crux. The law therefore must decide, number one, was the doctor's action a reasonable decision amid a great deal of uncertainty, or two, did the doctor's conduct fall below the standard expected of a competent professional? The answer isn't just legal. It ripples through every hospital, insurance policy, and patient conversation. Now I need to take you to the Bolam and Bolitho test, the heart of the law. The answer to these questions takes us through a journey of legal history. In 1957, the legendary English case of Bolam versus Free and Hospital Management Committee is where the story really begins. Now, the Bolam principle in the Bolam case states, if a doctor acts in accordance with a practice accepted by a responsible body of medical professionals, then the doctor is not negligent, even if other experts might disagree with what he did. So rather than punishing all differences of opinion, the law gives a shield, a sort of a legal umbrella to protect professional choices made in good faith. But there's a twist. In 1997, there was a case called Bolitho versus City and Hackney Health Authority. In Bolitho, the courts decided that it's not enough for medical experts to simply turn up and back each other up. The medical expert's opinion must make logical sense. If their reasoning is shaky, the court is not obliged to accept their opinion. Judges have the last word on what counts as responsible practice and whether the logic, when tested, can stand up to scrutiny. So in Malaysia, does the Bolam test shield doctors completely? Not so fast. In 1992, there was the Rogers versus Whitaker test. This concerned the patient's right to know. The Australian courts shifted the ground rules in Rogers and Whitaker, and this changed how doctors must inform patients about risks before medical procedures. This rule is different from the Bolam test, which is for diagnosis and treatment. Suppose a patient wants to undergo surgery. In Rogers, the Australian court asked, if there is a risk in the procedure, is there a risk in the procedure? Something a reasonable person would want to know. Then, what should the doctor tell the patient? The answer, the court said, was the doctor must warn the patient about any material risk. A risk a reasonable person in the patient's position would want to know. The court sets what that standard is, not the doctor's. If a risk is significant, the doctor must explain the risk to the patient. Only then should the patient decide whether to proceed with the procedure. The rule returns power and respect to the patient, allowing an informed choice. The Rogers ruling has now shaped how doctors advise patients in other countries, including Malaysia. The heart of the rule is simple. Patients have the right to know all the important risks before making a decision. This is true respect for autonomy and patient dignity. What do Malaysian cases say? Look at our local wisdom. Now, in the 2017 Federal Court case of Zul Hasnima versus Dr. Kupu Velumani, the Federal Court reaffirmed the Bolam test for diagnosis and treatment, but used a separate Rogers test for duty to advise. So, Malaysian courts ask, was the doctor's decision one that a reasonable professional would support? Did the doctor provide an explanation to the patient about the risk? So now it's a twin test, demanding both professional integrity and patient respect. Let's look at stories from real cases, whether an error is forgivable. In the old case of Swami versus Matthews, a doctor gave a drug dose within accepted ranges. The doctor's prescription was different from the guidelines issued by the manufacturer, but the court said, as long as the choice reflected accepted professional practice, it wasn't negligent, even if someone else might have chosen differently. But watch out. If a doctor ignores clear dangers, skips obvious steps, or fails to alert a patient to risks, that's a whole other story, and the law won't shield him. So then negligence enters when carelessness and breaches from accepted medical standards. Now consider split-second decisions versus systemic realities. Medical cases often turn on what doctors did in an urgent moment. The courts usually give a great deal of latitude for reasonable split-second choices so long as they are professionally defensible. But let's not ignore the real pressure cooker reality. Doctors in our hospitals are exhausted. Sometimes they work up to 84 hours per week, sometimes 30 hours non-stop. Exhaustion breeds what? Correct decisions, errors. Yet the courts rarely acknowledge how systemic problems like overwork and lack of support and exhaustion set doctors up to fail. Should our legal system take a hard look at these pressures? If we blame only the doctors as individuals, do we let the system off the hook? What is the difference between doctors, judges, and the difference between consequence and correction? One doctor asked me, turn the tables for a moment. I believe his name was Dr. Mahadevan. If a judge makes a bad decision and that is overturned on appeal, can the judge be sued for negligence? Now, the Courts of Judicature Act say no, except in cases of dishonesty. Errors in judgment are part of human reality. There's always an appeal when there's an error of law. But if a doctor or his mistake causes death or permanent harm, there's no appeal. There's no rewind button. This is why society demands higher vigilance in healthcare. We need to deal with the question of judgment, insurance, and who pays the price. These differences matter not just in law books, but in your wallet. When courts hold doctors liable for every slip, insurance costs will rise. Hospitals raise their fees. In the end, patients, meaning all of us, bear the cost. Is this fair? Or are we making healthcare too expensive for the majority? So we need to consider the issue of fairness in accountability, and in drawing the line, what is the law's secret formula? An honest error of judgment made with diligence, knowledge, and care doesn't amount to negligence. But reckless acts, blatant carelessness, or walking blind to accepted standards, these do attract negligence. But you see, doctors are not insurers. They cannot promise perfection. They do not guarantee your healing. They can only promise to bring their best professional effort. The plaintiff must show not just that an injury occurred, but that it was due to a lack of reasonable skill and care, which is in fact a legal principle that has echoed for nearly 2 centuries. So, a democratic reminder. Law balances risk and compassion. We, the people, ought to appreciate that every single day doctors battle uncertainty. The law tries to protect both safe medicine and fair compensation for harm. As medicine evolves, our courts face a great many tough questions. How do we empower patients, maintain affordable care, and motivate doctors to do their best without paralyzing the doctors with fear? So, should doctors face liability for every error of judgment? The law says no, provided that their decisions reflect logical, professional, and compassionate care under pressure. The real challenge is this: getting this balance right, not just in courtrooms, but in hospitals, in policies, and in everyday practice. Let's keep this conversation alive, because the next time it could be you, or I, or someone you care about on the table. So, I hope this made some sense. Goodbye, and thank you.